What if the safest place you could put an aging loved one is statistically one of the most dangerous? This isn't just a provocative question. It's the unsettling conclusion of decades of gerontological research that often goes unspoken in mainstream discussions about elder care. We're about to reveal a hidden truth about institutional systems and give you a comprehensive guide to 7 powerful, proven paths forward. The goal isn't to instill fear, but to empower you with knowledge that can preserve independence, dignity, and precious time. My name is Sam, and for the last decade, I've been helping families navigate these emotionally charged and logistically complex choices. The decision often feels binary: struggle alone at home or surrender to a nursing facility. Today, I'm exposing the nuanced data and giving you a detailed roadmap filled with alternatives you may not know exist. The first option is an accessible starting point for many, but the final model we'll explore will completely redefine what it means to age with community and purpose. Stick around, because by the end, you'll have more than just a list. You'll have a framework for making a decision aligned with your values, finances, and your loved one's vision for their later years. But first, let me ask you directly. How old are you, and what city are you tuning in from today? Are you planning for your parents, or perhaps thinking decades ahead for yourself? Drop it in the comments. We read every single one, and these details help us understand who we're serving. Now, let's start with a number that should stop you cold. Research tracking tens of thousands of seniors reveals a disturbing pattern. Within just half a year of entering a standard skilled nursing facility, mortality rates can surge by over a third compared to peers with similar health profiles who remain in their communities. Let that sink in. The transition itself, often during a vulnerable period following a hospital stay, carries a significant risk. But the peril isn't solely physical. The psychological architecture of traditional care, the loss of autonomy, the regimented schedules, the erosion of personal identity, can be devastating. Feelings of profound loneliness and helplessness can push depression rates near 50%, creating a vicious cycle where mental decline accelerates physical decline. The very system designed to offer safety and medical oversight can, for many, unintentionally hastens a comprehensive decline. But this bleak picture is not an inevitable fate. What if you had better, more humane choices that aligned with how people actually want to live? The good news is that science-backed, practical, and increasingly available alternatives do exist. These models are designed to preserve independence, foster joy, and add years of quality life. I've ranked 7 for you today, moving from solid and widely available options to truly revolutionary community-based concepts. And when we reach number 1, you'll see a member-driven model that compelling research suggests doesn't just slow the negative effects of aging, it can help reverse trends of loneliness and decline, often for a fraction of the financial and emotional cost of institutional care. This journey will take us from modest day programs to entire reimaginings of neighborhood support. Let's begin with a foundation many families overlook. Number 7. Community day programs. Think of this not as a clinical service, but as a vibrant, purposeful club specifically for seniors. These community centers offer structured social activities, nutritious group meals, therapeutic arts, and gentle exercise during daytime hours, with everyone returning to their own familiar homes in the evening. It's a critical lifeline for socialization and mental stimulation, combating the isolation that can swiftly diminish a person's health. The data supporting these programs is robust and compelling. University-led studies indicate that regular participants show significantly fewer behavioral challenges and demonstrate marked, measurable improvements in cognitive function, especially beneficial for those in the early stages of memory loss. The simple, powerful act of being around others, sharing stories, engaging in cooperative tasks, directly cuts through deep loneliness. One major longitudinal analysis found that consistent attendees experienced depression rates nearly half that of their peers who remained isolated at home. The benefits extend to family caregivers as well, providing them with reliable respite to work, manage other responsibilities, or simply recharge, making them better, more patient supporters. The financial calculus here is also a major factor. Nationally, the average cost for a full day at a quality adult day center is about $80. Contrast this with the average daily rate for a semi-private nursing home room, which now easily exceeds $250, and often climbs much higher in metropolitan areas. The annual savings can amount to tens of thousands of dollars, while allowing a senior to maintain their residence. To find an excellent program, an in-person visit is non-negotiable. Look for centers where participants are engaged, talking, creating, moving, not passively parked in front of a television. Ask specific questions about staff training in gerontology and dementia care, and inquire about participant-to-staff ratios. The best centers maintain a ratio no higher than 6:1 to ensure meaningful interaction. The primary limitation is clear. This model requires a safe and stable home environment and a caregiver for evenings, nights, and weekends. This very need leads us logically to our next, more comprehensive option. Number 6. Personalized home care. This represents the fastest-growing segment of elder care for a fundamental human reason. It allows individuals to age where their life stories unfolded, surrounded by their possessions, memories, and neighborhood rhythms. Professional caregivers, aides, or nurses come to the home, providing tailored support that can range from a few hours of companionship and light housekeeping to 24/7 live-in assistance with all activities of daily living. The evidence supporting aging in place is rock solid and transcends mere preference. Polls consistently show that over 90% of seniors want to remain in their own homes as long as possible. More critically, research from institutions like Harvard Medical School indicates that those who succeed in doing so with adequate support maintain their physical functional abilities significantly longer and experience fewer hospitalizations and infection risks than those transitioning to institutions. The therapeutic power of familiar surroundings, the chair that fits just right, the kitchen laid out from memory, the view from a beloved window, has a measurable positive impact on emotional and cognitive well-being. Services typically split into two broad categories: non-medical home care, which includes help with bathing, dressing, meal preparation, medication reminders, and transportation, and medical home health care, which involves skilled nursing services like wound care, physical therapy, and chronic disease management, usually prescribed by a physician, and often covered by Medicare for limited periods. The key to success is finding the right care partner. This requires thoroughly vetting agencies. Ask about the rigor of their background checks, the depth of their initial and ongoing training, and how they supervise and support their caregivers. Be candid about current needs and anticipate future ones to find a good match. Costs vary widely by region and care level, but the national median for non-medical care hovers around $30 per hour. It's crucial to explore all financial avenues. Long-term care insurance policies often cover in-home care, and veterans' benefits may be available. But a pressing question remains. What happens when the family home itself becomes too large, too isolating, or physically challenging to navigate safely? This brings us to a creative housing solution. Number 5. The family hub concept, also known as accessory dwelling units or granny flats. Imagine a separate, fully equipped small home, a converted garage, a finished basement with a private entrance, or a charming cottage, constructed right in the backyard of a family member's property. This innovative arrangement allows older adults to live just seconds away from loved ones while preserving precious autonomy and privacy for all generations involved. Psychological research on this multi-generational living dynamic is striking. Seniors in these dedicated, proximate setups report dramatically higher levels of life satisfaction and lower rates of depression than those in institutional settings. They enjoy the profound security of knowing help is immediately available while completely avoiding the feeling of being a burden or losing their independence. Dignity and a sense of control remain intact. For the hosting family, it offers peace of mind and the opportunity for daily, casual connection that strengthens bonds. Building an ADU requires navigating local zoning laws, which have been relaxing in many cities and states to address housing shortages. The construction process can take several months and represents a significant upfront investment, with costs ranging from $60,000 to several $100,000, depending on size, materials, and site work. However, when compared to the annual cost of a private nursing home room, which can soar past $90,000 and continue indefinitely, this one-time capital investment often pays for itself within a handful of years. Furthermore, it permanently increases the overall property value. When designing the space, universal design principles are key. Focus on features like zero-step entries, wider doorways for potential wheelchair access, lever-style door handles, and strategically placed grab bars in bathrooms. This model beautifully facilitates the give and take of family life. Grandparents can help with afternoon childcare, while adult children can easily assist with heavier groceries or provide quick check-ins. Yet, for seniors without family nearby, or for those who don't own property, Another brilliantly simple and social solution has gained remarkable traction. Number 4. Home sharing networks. Here's a concept that turns two modern problems into a mutual solution. Consider an older homeowner who has extra space but struggles with maintenance, loneliness, or rising property taxes. Now consider a younger person, perhaps a graduate student or a social service worker, who is priced out of affordable housing in the area. A formal home sharing program, often run by a nonprofit or local agency on aging, carefully vets and matches these individuals based on lifestyle, needs, and preferences. The senior gains companionship, a sense of security, and often help with chores in exchange for reduced or waived rent. The younger housemate gains affordable lodging and, frequently, a meaningful intergenerational relationship. This arrangement is far more than an economic hack. It's a health intervention. Studies from Centers on Longevity show that seniors engaged in intergenerational co-living experience slower rates of cognitive decline, likely due to the daily spontaneous mental stimulation of conversation and new ideas. The simple, consistent presence of another person in the home also means that if a fall or medical emergency occurs, help is there immediately, potentially saving a life. These programs also mitigate the crushing social isolation that plagues both seniors and younger adults in today's fragmented society. To get started, families should connect with their local area agency on aging, or search for established home-sharing nonprofits in their region. Reputable programs conduct thorough background checks, facilitate detailed interviews, and help draft written agreements covering rent, chores, guest policies, and conflict resolution. This option works best for older adults who are relatively independent, but shouldn't be living alone, and who are open to sharing their space. The financial benefit can be substantial, often saving the senior $1,000 or more per month in potential rental income or the cost of a hired helper. However, for individuals whose needs have progressed to require consistent professional, personal, or medical care, a more supported environment becomes necessary. This leads us to a comprehensive, all-encompassing community model. Number 3. The All-in-One Continuing Care Retirement Community, or CCRC. These are expansive, campus-like settings that offer a full continuum of care: independent living in cottage-style homes or apartments, assisted living for help with daily activities, and skilled nursing care, all located within the same integrated community. The fundamental promise is that an individual can move in while active and independent, and then transition through higher levels of care as needed, without ever having to leave the community, their social circle, or their supportive environment. The longevity and well-being data associated with high-quality CCRCs is impressive. Multi-year studies have shown that residents in these communities often live longer, healthier lives than their demographics would predict. Researchers attribute this to several factors: the elimination of the traumatic, disorienting relocation during a health crisis, the availability of on-site preventive health services and wellness programs, and the critical maintenance of social engagement and purpose across all stages of aging. The deep social ties formed during independent living provide a cushion of support and familiarity that persists even if cognition or mobility declines. Life in a CCRC typically begins in a private, full-featured residence. Residents lead completely independent lives, but have access to community amenities like dining venues, fitness centers, pools, and extensive activity calendars. As needs change, they can transition to assisted living, where staff help with medications, bathing, and dressing, and finally to skilled nursing for round-the-clock medical care. The financial model is significant and requires diligent planning. Most CCRCs require a substantial upfront entrance fee, which can range from the low six figures to over $1 million, followed by ongoing monthly fees. Contracts vary greatly. Some are essentially real estate purchases with equity, while others are more like rental agreements or offer limited refunds. It is imperative to scrutinize the contract type, the community's long-term financial stability, and its history of fee increases. Always visit multiple times, at different hours, and speak candidly with current residents and their families. The primary drawbacks are the high cost, which places it out of reach for many, and frequent multi-year waiting lists for the most desirable communities, necessitating very advanced planning. Now let's move into our final two categories, which represent not just alternatives to the nursing home, but a complete philosophical reinvention of what elder care can and should be. Number 2. The family-style home model, best exemplified by the Greenhouse Project. Erase the mental image of long, linoleum-lined hallways. Instead, picture a real, residential-scale house that is home to just 10 to 12 seniors, each with a private bedroom and bathroom. The heart of the home is a shared, open kitchen, dining, and living area, where meals are cooked from scratch, and life happens collectively. Specially trained staff, called Shabazim, are universal workers. They provide all care, prepare meals, and manage the home, allowing them to build deep, knowing relationships with each resident. The outcomes documented in peer-reviewed journals are nothing short of stunning. Studies published in major health journals found that residents in these greenhouse homes experienced roughly half the hospitalization rate of those in traditional nursing facilities. Devastating but preventable conditions like pressure ulcers occurred at rates up to 96% lower. The model also benefits caregivers. Staff turnover is dramatically lower because the work is more relational and less transactional. Most importantly, every metric of quality of life, from personal choice and social engagement to reported happiness, soars. Families visit more frequently and for longer periods because the environment feels welcoming and normal, not clinical or intimidating. One researcher famously noted the profound sensory difference. Walking into a greenhouse, you smell dinner cooking, not disinfectant. Finding one of these homes requires targeted searching, as several hundred now operate across the United States, with more in development. The daily cost is generally comparable to that of a traditional nursing home, and they are certified to receive Medicaid and Medicare payments. If you are considering nursing home level of care and a greenhouse exists in your area, you must visit. The contrast in atmosphere, noise level, and resident engagement is immediately and powerfully apparent. Yet, a compelling question persists. What if you could capture the core benefits of this model? Deep community, personal autonomy, and a home-like environment, without having to move from your own house at all. This brings us to the most decentralized and empowering alternative of all. Number 1. The neighborhood village movement. This represents the most radical shift in perspective. Aging is not a problem to be managed in a facility, but a stage of life to be supported within the fabric of the existing community. In the village model, older adults stay in their own homes, but join a member-driven, non-profit organization that provides a vetted network of services and a built-in social community. Need a ride to a doctor's appointment? A volunteer member will drive you. Need a trusted handyman to fix a leaky faucet? The village has a list. Looking for a weekly book club, a walking group, or a lecture series? The village calendar is full. The research validating this community-based approach is revolutionary and offers profound hope. A landmark study from the Johns Hopkins Bloomberg School of Public Health meticulously tracked village members over multiple years. The results showed that members experienced measurably slower rates of both physical and cognitive decline compared to a matched control group of non-members in the same localities. They had fewer hospital admissions, lower rates of depression, and, perhaps most remarkably, their self-reported quality of life scores did not just decline more slowly. In many cases, they actually improved. The village provided a psychological buffer against the losses often associated with aging. For annual membership dues that typically range from $400 to $800 for an individual, members gain access to a part-time coordinator who helps facilitate services and a robust volunteer network. The true magic lies in the ethos of mutual aid. Members both give and receive help. A retired teacher might volunteer to provide tech support to a neighbor, while later receiving help with grocery shopping. This reciprocity builds social capital and purpose, fundamentally avoiding the charity case dynamic that can erode dignity. It transforms aging in place from a hopeful slogan into a logistically supported, socially rich reality. Starting or joining a village requires initiative. The Village-to-Village network provides extensive toolkits for communities looking to launch their own chapter, a process that typically takes 18-24 months of dedicated volunteer effort. For those near an existing village, joining involves an application and paying the annual dues. The financial contrast with institutional care is, once again, breathtaking. hundreds of dollars per year versus hundreds of dollars per day. The model's limitation is its dependence on critical mass and volunteer spirit. It may not be suitable for those who need intensive daily hands-on care, though it can be perfectly paired with paid in-home care for a hybrid solution. The collective evidence is undeniable and empowering. You and your family have a spectrum of powerful, proven choices that exist far beyond the outdated binary of struggle alone or enter a nursing home. From the social engagement of day programs to the autonomy of home care, the innovation of accessory dwellings, the mutual benefit of home sharing, the security of continuing care communities, the humanity of family-style homes, and the empowerment of the village network, these models collectively offer a future of better health, sustained happiness, and fiercely protected dignity. Do not wait for a medical crisis to force a rushed, panicked decision. Start exploring these alternatives now, while there is time for thoughtful evaluation and planning. Visit locations, talk to administrators, and, most importantly, speak with current residents and their families. Build a support plan that genuinely values independence, connection, and individual purpose. The robust science we've discussed supports this approach, and thousands of families across the country are already living it, proving that a different, better way is not only possible, but is already here. Now I want to hear from you. Has your family tried or researched any of these alternatives? What was your experience? What worked brilliantly? And what challenges did you encounter? Sharing your story in the comments below creates a valuable resource for others on this same journey. Your insight could be the guidepost another viewer needs. If this detailed exploration gave you a new perspective and valuable tools, please do me a huge favor and like this video. It signals to YouTube that this content is helpful and helps the channel Wines of Thought grow and reach more families who need this crucial information. Thanks for investing your time in this important planning, and remember, when it comes to caring for our elders, the best solutions often look less like medicine and more like community.